talking about some breathing mechanics. This is something I go over with almost every patient who has low back pain, neck pain, stiffness in their shoulders, a rib injury, because we breathe 20,000 times a day, and breathing affects our entire torso. And so if we're doing something incorrectly 20,000 times, that could have a big effect on how our low back feels, how our neck feels, how anything related to breathing feels. And so what we want to do is have a 360-degree expansion of the torso as we breathe and a contraction as we exhale. So a good place to start is just place your hands right here, kind of right just towards the sides. And as I inhale, I want my hands to come towards you and also out a bit. And then as I exhale, my fingers come in. Inhale and exhale. I can also have hands on either side of the back because I want to be able to expand my abdomen outwards as my diaphragm drops down, but I also want to feel like I can get some expansion into the lower back. So I'm going to inhale, exhale. I'm going to feel more movement here on my front hand, but I want to feel a little bit of pressure into my backhand as well. I'll also note that we want these breaths to be in and out through the nose. Nasal breathing should be our default as it better oxygenates the blood. It helps engage the parasympathetic nervous system, which is our rest, digest, recover part of the nervous system. It's just a more efficient way to breathe. So as you're practicing this, we want to inhale through the nose, and if we can, a slightly slower exhale. So we're expanding, trying to expand in every direction from right below the ribs. That's where the diaphragm sits, and the ribs should ideally tip out and expand through the back. The last thing I'll mention on breathing mechanics is that the muscles of the neck and shoulders should be relatively quiet. Almost every patient I see who has neck pain and sometimes shoulder pain, they say they feel crazy tight through some of these muscles. What I often find is that they're using these muscles to breathe. And so those muscles feel tight because they're engaging them all the time, all day. It's like if I squeeze my hand all day, my fingers would start to get tight. My forearm and gripping muscles would start to be tight. I could stretch them and that would feel good. But if I don't solve the root cause, which is me squeezing my hand all day, that tightness is not going to go away. So with a lot of these neck muscles, which is so common, what I find, and we can often feel this together in my office when we start doing some hands-on work to calm things down. Maybe I'm doing some gentle cervical soft tissue work, I'm cradling their neck in my hands. I ask them to take a couple breaths, and I can feel their muscles actually twitching underneath my hands as they breathe. And I can cue that and say, hey, did you feel those muscles firing as you breathe? Usually they say yes as we bring awareness to it. And then we start cueing the diaphragm breathing. We start cueing the ribs moving as they breathe, trying to keep these muscles quiet. So the last breathing exercise you can do, we can go hands here to really feel the abdomen, the lower part of the torso and ribs move. Likewise, we can also just get a gentle cross of your hands here. You can do this sitting, laying down, kind of hands just on the base of the neck and the chest. And as I breathe, I want the movement to happen kind of below my elbows and the muscles of my neck and shoulders to stay relaxed. So as I inhale and exhale, you see maybe a gentle movement of my hands, but what we're not seeing is a big movement here. And you can practice breathing through your nose or breathing through your mouth. Often if you breathe in through your mouth, you're going to see more movement through here. So those are called accessory breathing muscles. They're designed and we evolved for these muscles that we should be engaged up here when I'm going for like an all-out sprint, like a top-end respiratory effort. That's when I really need some big movement of the rib cage, the torso, to get as much air in and out as possible. But just that baseline, if these muscles are firing every breath, that's like you're squeezing your hand 20,000 times every day when really it should be relaxed. So that can often be a root cause of some of the stiffness. So that's a basic primer on some breathing mechanics, thinking about the diaphragm, the lower rib cage, the chest moving last, and very little at a baseline resting breath.